ever wondered if that trip to the dentist for a root canal could be done in one go instead of like multiple appointments?
Yeah.
You've shared some research on this very topic.
Absolutely.
And we're going to dive deep into what it all boils down to.
Yeah, the big question we're tackling today is,
okay,
is it better to get it all done in a single visit?
Right.
Or spread it out over a few
appointments.
Appointments, exactly. And you've pointed to some key research here. The Cochrane Systematic Review, which...
Okay, now a Cochrane review, for anyone who hasn't heard of it.
Yeah.
What makes that such a...
reliable source.
Reliable source for this kind of question?
Think of it as a super thorough
okay.
investigation. A Cochrane Systematic Review pulls together all the best available research on a specific medical question.
Right.
In this case, single versus multiple visit root canals.
Okay.
It's designed to give you the clearest, most unbiased answer.
Okay.
Based on the science.
Based on the science.
They look at how effective each approach is.
Right.
What the potential downsides or complications.
Okay, so our mission for this deep dive is to cut through all that research.
Exactly.
And figure out
what
the actual science says.
What the science says.
About these two ways of doing a root canal.
Precisely.
We want to know which one works best and what kind of issues you might run into with either option, both in the short term and down the line.
Yeah, the review looks at some really key outcomes.
Right.
For example, did the tooth eventually need to be pulled?
Okay.
Did the treatment fail when they looked at the x-rays later?
Okay.
And then those more immediate concerns like how much pain or swelling people experienced afterwards and how much pain medication they needed.
Yeah.
Even things like the development of sinus tracts.
Okay, so this isn't just one person's opinion. This is, where did this information actually come from?
So this deep dive is primarily based on this Cochrane Systematic Review, titled Single versus Collards, Multiple Visits for Endodontic Treatment of Permanent Teeth.
Wow.
By Fagini et al. And it was published in the Journal of Endodontics back in 2008.
Okay.
What's really important is that this review didn't just look at one study. It actually combined the findings from 12 different studies.
Okay, 12 studies. That sounds like a
solid foundation.
Solid foundation. Okay.
Yeah.
Let's get right to the core of it. How effective are these two approaches overall?
Yeah.
When you get a root canal, you want it to work in the long run. What did the research say about that?
The main way these studies measured long-term success was by looking at x-rays a year or more after the treatment.
Okay.
They were looking for what they called radiologic success.
Okay.
Which means the area around the tip of the tooth root showed signs of healing.
And when they put all that data together from the 12 studies, what did the Cochrane Review find when they compared doing the root canal in one visit versus multiple visits in terms of this radiologic success?
What's fascinating here is that the review found no real difference in how well the root canal worked in the long term.
Okay.
Regardless of whether it was done in one visit or spread out. Both approaches seem to have pretty much the same success rate when they looked at those follow-up x-rays.
So the headline here is...
The headline is...
Both approaches seem to get the job done.
Get the job done.
In the long run.
In the long run, according to the strongest available evidence.
Interesting. So whether you get it done in one go or have to go back for another appointment, the chances of the root canal being successful, at least as far as the x-rays can tell us, are basically the same.
That's the main takeaway now.
Okay.
There was one specific analysis within the review that hinted that maybe a single visit treatment might be slightly better, suggesting about a 15% higher success rate. But the researchers were careful to point out that when they did what's called a meta-analysis, which is where they statistically combine the results of several studies, in this case 5 studies with 657 patients. That small potential advantage for single visits wasn't statistically significant. So
it's an interesting signal.
It's an interesting signal.
Well, we can't say for sure.
I can't say for sure.
That one is definitively better than the other.
Yeah.
When it comes to healing as seen on x-rays.
Exactly.
Got it. So a possible slight edge to a single visit in one analysis.
Yeah.
But overall, the evidence says they're about equal in the long run.
About equal.
Now, how did these individual studies actually measure this radiologic success?
That's a really
insightful question.
It's not just a simple thumbs up or thumbs down on an x-ray.
So the different studies actually use slightly different ways to assess healing on the x-rays. For example, some use something called the periapical index score, or PAI score, which is a way of grading the health of the tissue around the tooth.
Others use different criteria like Strindberg's criteria or Gutman's criteria. However, to be able to compare all these studies in the Cochrane review, the researchers took all those different scales and simplified them into a basic result. Either the treatment was a success, meaning healing was evident, or it was a failure, meaning healing wasn't adequate.
Right, so they standardized the outcome to make a fair comparison across all that research.
Exactly.
That makes sense. They needed a common yardstick.
Yeah.
Now let's switch gears and talk about those short-term complications you mentioned. What can you tell us about how much discomfort people might experience after a root canal? And whether that differs between single and multiple visits? That's probably top of mind for anyone facing this.
Absolutely. So the review looked at discomfort at different points in time after the root canal for that immediate period, which they defined as up to 72 hours after the procedure. Their analysis of 6 studies involving over 1,000 patients showed no real difference in how often people experience discomfort. Whether they had the root canal finished in one appointment or not. So in those first few days, you're about as likely to have discomfort either way.
So no clear winner there.
No.
In terms of immediate pain.
Immediate pain.
What about a bit further out, say, a week after the treatment?
When they look at the data from 5 studies with 936 patients, they found that discomfort at 1 week was actually less common after multiple visit treatment. However, and this is a recurring theme, when we look at the details, this difference wasn't statistically significant. So while there's a hint that multiple visits might lead to a slightly easier week after, we can't say for sure based on the evidence that it's a significant benefit.
And what about even longer term, like a month after the treatment? Are people still reporting discomfort then?
Unfortunately, there just wasn't enough information in the studies to draw any firm conclusions about that. Only 2 of the studies in the review actually reported on discomfort at 1 month. And in both of those, no patients reported having persistent discomfort. Because the rate of discomfort was 0 in both groups. They couldn't really do a comparison.
Not much to compare.
Not much to compare.
If no one's feeling ongoing pain.
If no one's feeling ongoing pain, exactly.
You also mentioned that one particular study couldn't be included in the main analysis of discomfort over time because of how they presented their findings. What did that specific study show?
That was the study by Yildiz et al. Interestingly, even though they couldn't be part of the main statistical combination for discomfort timing, they also found no significant difference in overall amount of discomfort reported
between
the single and multiple visit groups. They did observe, however, that the discomfort tended to peak in the first 48 hours. And then gradually decreased over the following week. Which lines up with what we generally expect in terms of post-operative healing. And importantly, their study also found that patients whose teeth were already causing problems before the root canal were more likely to experience discomfort afterwards. Regardless of whether they had a single or multiple visit treatment.
That makes sense. If the tooth was already inflamed, it's going to take some time to settle down.
Exactly.
Let's move on to another potential short-term issue, swelling. What did the review uncover about that?
Trying to compare swelling. Or what dentists sometimes call flare-ups. Across the different studies turned out to be a bit tricky. Because the studies didn't all use the same definition of what constitutes a flare-up. Some lumped together both swelling and severe pain, making it hard to isolate just the swelling data.
However, the review did focus in on 3 studies that specifically defined a flare-up as the presence of swelling.
And what did those 3 studies tell us about the risk of swelling? With single versus multiple visits?
These 3 studies, which included 192 patients in total, suggested that swelling seemed to be less common with multiple visit root canal treatment compared to single visit treatment. But just like with some of the discomfort findings, the researchers found that this difference wasn't statistically significant. So we can't definitively say that multiple visits will reduce your risk of swelling.
So a hint that multiple visits might be better for swelling, but not a guarantee.
Exactly.
Now, you mentioned a really interesting detail from one of those studies.
Yeah.
The one by Gudusi et al.
Yes.
About the use of medication between visits.
Yeah.
What did they find?
This is where it gets really interesting.
Okay.
The Gudusi study
had a group of patients who had multiple visits.
Okay.
In some of those patients, the dentist placed no medication inside the tooth between appointments.
Okay.
While in others, they used calcium hydroxide, which is a common antibacterial medication used in root canals because it helps to kill any remaining bacteria inside the tooth.
Okay.
What they discovered was that when no medication was used between visits, the amount of swelling in the multiple visit group was very similar to what they saw in the single visit group. However, when calcium hydroxide was used as medication between visits, the multiple visit treatment resulted in a much lower amount of swelling.
Wow, that's a really key insight.
Yeah.
It suggests that the potential benefit of multiple visits in terms of less swelling might not just be about having more than one appointment.
Exactly.
But specifically about using some kind of antibacterial medication inside the tooth.
Exactly.
In between those appointments.
That's a great point.
So it's not just single versus multiple visits, but what happens during those multiple visits. That seems to be crucial when it comes to swelling.
Exactly. This really highlights a potential advantage of using intracanal medication to reduce swelling in multiple visit cases.
Yeah.
Especially in this particular study where they only used saline solution to clean the canals.
Right.
It strongly suggests that the antibacterial action of the calcium hydroxide might be playing a significant role in preventing or reducing postoperative swelling. So it's not just single versus multiple visits.
Yeah.
But what happens during those multiple visits, that seemed to be crucial when it comes to swelling.
That's a really important nuance to be aware of.
Absolutely.
What about the need for pain medication after the procedure?
Yeah.
Did the review find any differences in how often people needed painkillers?
Yeah.
Depending on whether they had a single or multiple visit root canal?
Yes, they did find a statistically significant difference there.
Okay.
A meta-analysis of 3 studies that looked at how often patients use pain medication after their treatment, involving a total of 559 patients, showed that the use of pain medication was significantly more common in patients who had single-visit root canal treatment compared to those who had multiple visits.
So essentially, if you go for the single visit, be prepared that you might need a bit more help with pain in the immediate aftermath.
Absolutely.
That's a pretty clear finding.
Yeah.
Then, so opting for a single visit root canal might mean you're more likely to be reaching for the pain relievers afterwards? Why might that be?
So the review authors speculated that it could be due to a potentially more intense inflammatory response in the tissues around the tip of the tooth after a single longer treatment session.
So to recap the short-term stuff, discomfort seems pretty similar overall.
Pretty similar.
Maybe a slight hint of less discomfort at 1 week?
At 1 week.
With multiple visits.
Multiple visits.
But you are more likely to need pain medication.
Pain medication.
After a single visit.
Single visit.
And the potential for less swelling with multiple visits appears to be linked to whether medication is used between appointments.
Absolutely.
What about those longer-term complications we mentioned earlier?
Yeah.
Like whether the tooth eventually needs to be extracted or the development of sinus tracts?
Interestingly, the Cochrane review found that none of the 12 studies they looked at actually investigated tooth extraction as a direct result of problems with the root canal treatment.
That's a bit surprising when you think about it as a key measure of long-term success.
That's interesting, isn't it?
Yeah. Does the review offer any reasons why this wasn't a primary focus in these studies?
The review itself doesn't delve into the specific reasons why extraction wasn't a primary outcome. But it's possible that the follow-up periods in these studies weren't long enough to capture a significant number of extractions specifically linked to the root canal treatment failing.
Right. It could also be that other factors play a larger role.
Exactly.
But the decision to extract a tooth down the line.
Absolutely.
Similarly, the review found that no studies specifically examined the formation of new fistula or sinus tracts or the resolution of existing ones as a direct comparison between the two treatment approaches. So on those specific longer-term complications, the review couldn't really give us a clear answer based on the evidence they analyzed.
Based on the evidence they analyzed.
So not much data there on those very long-term outcomes.
Not much data. data.
Let's step back for a moment and think about why a dentist might recommend one approach over the other.
Yeah.
The review touched on some of those factors that influence the decision, right?
Yes, it did. The decision between a single visit and multiple visits for a root canal is actually quite a nuanced one.
Right.
And depends on a number of different things.
Okay.
Dentists will consider their own level of skill and experience.
Okay.
The specific condition of the tooth itself. Is the nerve alive or dead?
Right.
Is it painful right now?
Right.
Is there already swelling present?
Right.
Practical things, like whether they can realistically complete the entire treatment to a high standard in a single appointment.
Right.
And what the patient's schedule looks like.
That makes sense. You can't rush a complex procedure.
Exactly.
And the patient's availability is a real-world constraint.
Absolutely.
I suppose the patient's overall health and even how they feel about being in the dental chair for a long time versus multiple shorter visits.
Absolutely.
Could also be factors.
And then there are the specific anatomical and biological considerations related to the tooth and any infection that might be present.
Right.
The review also pointed out some potential advantages.
Yeah.
That might make a single visit root canal an attractive option.
Such as, what are the potential upsides of getting it all done at once?
Well, for most people, fewer appointments is a big plus. It also theoretically reduces the chance of bacteria leaking into the clean root canal system between appointments. If the tooth is going to need a post to support a crown later on. Sometimes that can be done immediately after a single visit root canal. There can also be some cost savings associated with fewer visits. And it might be more comfortable overall for the patient by avoiding repeated injections and having the rubber dam placed multiple times.
Those all sound like pretty compelling reasons to aim for a single visit. If possible. But then why do dentists sometimes prefer to spread the treatment out over multiple appointments?
That often boils down to the fundamental goal of root canal treatment. To eliminate infection and promote healing in the tissues around the tooth root. While also keeping the patient as comfortable as possible. Throughout the process. The review highlights the ongoing discussion about single versus multiple visits often revolves around the best way to deal with any remaining bacteria within the root canal system.
Right, we touched on that earlier with the swelling and the Gadusi study. What's the rationale behind using medication inside the tooth between visits?
So the idea behind placing an intracanal dressing like calcium hydroxide between visits is to try and eliminate any bacteria that might have survived the initial cleaning and shaping of the canals, or to prevent them from regrowing before the dentist permanently fills the canal. Calcium hydroxide is a popular choice. Because it's known to have antibacterial properties.
But the review also pointed out that calcium hydroxide isn't always completely effective at killing all bacteria, right?
That's correct. Research has shown that it doesn't always manage to completely eliminate all the different types of bacteria that can be present in an infected root canal. This is one of the key arguments, sometimes made in favor of the single visit approach. The aim is to be as meticulous as possible with the cleaning, shaping, and irrigation of the canals in one session. And then to essentially trap any remaining bacteria by completely filling the canal with a sealing material and gutta percha, which are the materials used to fill the canal. And these materials themselves can have some antibacterial properties.
So it's almost like two different strategies for dealing with any lingering infection. One uses time and medication between visits to try and eradicate it. And the other aims to clean thoroughly. And then seal it all up in one go. Now, the review also looked at what happened when they specifically analyzed the results just for teeth that had necrotic or non-vital pulps. Meaning the nerve inside the tooth was dead. Did the outcomes differ in those situations? You'd think a dead nerve might present a different kind of infection.
It does so. When they focused their analysis on just those teeth with necrotic pulps across 7 of the included studies, they found that the amount of discomfort reported was not significantly different between single and multiple visits. Interestingly, there was a trend suggesting less discomfort
in
in the single visit group for these cases.
Interesting.
which is a bit counterintuitive, but potentially significant.
Yeah.
And when they looked at the radiographic outcomes for these necrotic teeth, the single visit group actually showed a 38% better outcome.
Wow.
Although, again, based on their statistical analysis, this difference wasn't quite strong enough to be considered statistically significant.
Right.
So a trend towards better healing with single visits for dead teeth.
That's a surprising little twist in the data.
Yeah.
So for teeth where the nerve is already gone, doing it in one visit might actually have a slight advantage in terms of healing?
The trend is there in the data.
Yeah.
But the evidence isn't rock solid enough to make a definitive statement.
Right.
However, it does suggest that the effectiveness of single visit treatment might be particularly good in cases where the pulp is already necrotic.
Now, as we always need to consider, how good was the quality of the research that the Cochrane review looked at? Did they assess whether some of the studies might have had potential biases?
Yes, they did. That's a really important part of any systematic review. They evaluated each of the 12 studies and categorized them as having a low, moderate, or high risk of bias based on things like how well they made sure patients were randomly assigned to the different treatment groups and how many patients dropped out of the studies. They found that 4 studies had a low risk of bias. 4 were considered moderate and 4 had a high risk of bias. Importantly, for the reliability of their findings, the review authors then did what they call sensitivity analyses. This means they reanalyzed the data, this time excluding the studies that they judged to have a higher risk of bias, and they found that the main conclusions of the review still held up. So the overall findings aren't likely to be skewed by just the weaker studies.
That's definitely reassuring. It adds more confidence to the overall conclusions.
Absolutely.
And this review we've been talking about was published back in 2008. Has there been any more recent research since then?
That's a crucial point to consider. The Cochrane review itself mentions that after its initial publication in late 2007, there were 2 more recent randomized controlled trials. One published in 2007 and another in 2008. That also compared single and multiple visit root canal treatment specifically for teeth with necrotic pulps. The authors of the Cochrane review noted that the findings of these newer studies were consistent with their own. In that they also didn't find any significant difference in healing rates between the 2 approaches. They even mentioned that these new studies were planned to be included in the next update of the Cochrane review in 2009. Which just goes to show that this is an area where research is ongoing.
So based on this really thorough look at the evidence, it seems that for root canal treatment, both doing it in a single visit and spreading it out over multiple visits tend to have similar success rates in the long run when we're looking at how well the area heals. However, you might be a bit more likely to experience some swelling. And you'll probably need more pain medication after a single visit procedure. And it also looks like using medication inside the tooth between visits in a multi-appointment approach might be helpful in reducing swelling in some situations.
It seems that way.
Ultimately, the decision about whether to go for a single visit or multiple visits is a complex one.
It is.
With various factors to consider.
Absolutely.
And the best available evidence suggests that when it comes to the main goal, successful healing, both approaches can be effective. This deep dive really highlights how even seemingly straightforward medical questions can have a lot of nuances in the evidence. Perhaps the most important thing for you to take away from this is the importance of having a detailed conversation. With your own dentist about your specific situation. Things like the type of tooth involved. Its current condition, your own comfort level and preferences. And your dentist's expertise will all play a role. In determining the best path forward for your root canal treatment. What other questions does this deep dive raise for you about dental procedures and the evidence that informs them?